Welcome to today's webinar titled Trauma and Children, a Guide for Helping Children Manage Traumatic Events. We are thrilled to have Devin Sheehan with us today. Devin Sheehan studied at the University of West Georgia and holds a master's degree in psychology and a specialist degree in guidance and counseling. Over the past 20 years, she has worked with children, adults, with a wide range of mental health issues in both outpatient and inpatient settings, and has volunteered as an equine therapist for service members, veterans, and their families. She currently works as the resource coordinator for the Military OneSource. Ms. Sheehan is the proud daughter of a former Army National Guard soldier and lives in the National Capital Region with her significant other, an active duty Marine. Without further delay, I will turn things over to Devin Sheehan.
Thank you, Stan, and of course, thank you to the members of our audience for joining us. Before we begin, I do have a brief disclaimer to read to you. The appearance of hyperlinks does not constitute endorsements by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities, such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense-sponsored webinar. Our objectives today include learning about the types of reactions children and adolescents might have to trauma and ways to talk to children and adolescents and help them cope. And to achieve those objectives, we have here our agenda. We'll have a brief introduction, a discussion about children's fears after trauma, discuss the possible reactions to trauma for the different age groups, 1 to 5, 6 to 11, and 12 to 18, helping children cope, tips for talking to children, and what to do when problems or concerns don't improve. So first of all, we'll define what we mean by the term trauma. You're going to see this obviously throughout the presentation. So when we refer to trauma, we are using it in a very broad manner. Ultimately, trauma is an emotional response to an overwhelming or terrible event, such as a death, a natural disaster, a medical emergency, abuse, or an accident. And children can be affected by trauma whether they've actually witnessed it or only heard about it. You may have heard the term secondary trauma, where an individual actually experiences trauma as the result of hearing another person's story. And symptoms of this can actually mimic PTSD. Children are very susceptible to this. So even if they haven't experienced the trauma themselves, we do need to keep in mind that children may be experiencing that secondary trauma. Recovery is very individualized. One child's reaction and processing of trauma is not going to be the same as another's, even within the same family or involving the same trauma. So some children recover very quickly, and others may have more difficulty. While we do try, we can't always protect our children from trauma, but we can learn ways to help them cope and process their feelings. After a traumatic event, children may have fears that fall into these categories, that they or their family will be hurt, that the event will happen again, or that they'll be separated from their family. And a couple of these for the mental health providers out there, they may sound very familiar in cases of abuse. Some of the things that perpetrators will say to children is, if you tell somebody what's going on, then I'll hurt your family or I'll hurt your pets. If you tell anybody what's going on, they'll take you away from your family and you'll never see them again. So these are significant concerns that children may have as a result of a traumatic incident. We're going to be talking a little bit more in depth about the stages, the developmental stages, those age ranges that we touched on a little bit earlier. But before we get there, let's talk very briefly about overall reactions to trauma in general situations. Children respond physically to trauma with anxiety-related ailments, stomach aches or headaches, fatigue from not sleeping well, and of course sometimes by actually physically lashing out at those around them, biting or slapping or kicking, particularly if the child is at an age where they are struggling with verbal communication. If they can't get the words out, they're going to react somehow, and this often comes out physically. Children respond by regressing in their behaviors. For example, a child who has previously used the toilet with no issues may start wetting themselves, or an elementary school-age child may start having tantrums. Regressions are typically temporary. They're often tied to an emotional response, such as fear or anxiety. And socially, the child may withdraw from family and friends. They may retreat into imaginary play where somebody who is deceased, where a loved one who's deceased has actually come back and they're able to see and interact with them, or they may pretend that the trauma hasn't happened. They may have a fear of strangers. Some may become more physically clingy, or they may actually be more outgoing or physical. These reactions can be driven by their association with a stranger to the source of the trauma. For example, somebody who wears the same uniform as a lost parent may elicit a very outgoing and clingy response from a child, but somebody who has a similar appearance to an abuser elicits a more reserved or even fearful reaction. These responses are, as we said earlier, they're very individualized. They'll be different depending on the age and developmental level of the child. An 8-year-old's perception, for example, of a tornado that heavily destroyed the neighborhood will be very different from their 8-year-old or their 4-year-old siblings' reaction and perception. And because children will display behavioral changes as a result of really any change in their lives, remembering that enables parents and other caregivers to plan accordingly and help the child set up coping skills. One of the things that we definitely want to remember before we move on is children respond in part based on how their parents and their caregivers are responding to an incident. Anxiety breeds anxiety, sadness breeds sadness. A positive and encouraging outlook is going to breed the same. Okay, so let's talk a little bit about those developmental stages, those age ranges. And as we go through this, to understand what to look out for, which you'll see here on the screen, we also want to start with what's considered normal. So how do we know what to look out for and what to be aware of if we're not entirely sure what's happening in a normal developmental stage? Toddlers recognize and are able to point to familiar people, but absence of people is still a very abstract concept. They have a very limited awareness of time, so they don't understand somebody's gone, they're gone. They enjoy adult attention and are not very wary of strangers, and they're becoming independent and sometimes struggle a little bit with the normal routines of dressing and eating and bathing, and they'll have tantrums if they get frustrated. Preschoolers, if you're looking at the 3 to 5 age range, they can understand time a little bit better, so they understand sequences. After we have dinner, we're going to get a bath, then we're going to brush our teeth, and we'll read a story before we go to bed. They're outgoing, friendly, sometimes over-enthusiastic. They can have mood swings or seem to have very rapid mood swings, but these decrease as you get closer to the age of 5. And there's a lot of imaginary play, storytelling, and maybe a little bit bending of the truth. They may not necessarily understand that they're to an adult perception, lying. They just feel like they're bending the truth a little bit. So some of the possible reactions to trauma for this age range, they may regress to an earlier developmental stage, and that's where we see the toileting issues. They didn't have an issue before, but now they're beginning to wet themselves. Preschoolers in particular ask why, what, where, when, how, over and over and over again. Parents understand those why questions. Why does that happen? Why does that happen? And so they may refer to the event repeatedly, and they may ask a lot of very difficult or repetitive questions that the adults in their lives may have some trouble continuously answering. They could develop behavior problems. Again, we're looking at, for the younger children, some limited vocabulary, and as a result, you're going to see a lot of that physical reaction. They may have changes in eating or sleeping routines. They may actually feel that they caused the event. They have very magical thinking at this age, and they might feel like, oh, I thought something might happen and then it did, or I wished something happened and then it did. And they may fear going to school, preschool, or daycare, even if the incident didn't happen there. Maybe there was a hurricane and they were at school when it happened, and then they associate school with that incident. Even if it didn't happen there, they may fear leaving the family. They feel that being separated from the family somehow caused the event, and therefore they don't want to go to school and be separated again. Between the ages of 6 and 12, the child's world is starting to expand outward. We've gone from the family unit, and now we're involving friends and teachers and coaches and caregivers and others. It's an ever-expanding range of individuals who are involved with this child. And as a result, in these age ranges, children are spending a little less time with their families. They're spending more time at school, obviously, so they have more exposure to teachers and coaches and their friends. They need less direct monitoring and fewer verbal cues, and this is especially apparent in routine tasks. So they know to take their bath, they know to brush their teeth, and we can reason with them. If they have behavioral issues, we can use verbal reasoning, we can deprive them of their privileges, or remind them of potential consequences of their actions. This age group is actually more likely to display obvious behavioral or emotional signs of distress. And this includes withdrawing from family and friends, those regressive behaviors that we talked about earlier, particularly tantrum throwing, aggressive or angry outbursts, difficulty with sleeping or concentrating or eating. Their schoolwork suffers. They may, again, fear going to school. And they may express feelings of guilt, feelings of worry for other family members, and may have a preoccupation of making sure that everybody around them is safe. Okay, the teen years, we know, are those years when the wings are starting to spread out and the child is becoming closer to an adult. They're starting to exert their independence. They're pulling away from family, becoming more themselves. And they are able to understand more than the younger children. As a result of that understanding, they struggle with increasing responsibility, not just for chores and taking care of younger children, but also understanding their responsibility when an incident happens. So if, again, we'll go back to a natural disaster, a tornado or a hurricane, they understand their responsibility for helping in cleanup and keeping those younger children calm. And as a result of that, they also have issues with fear of the known. So they know what's going on rather than fear of the unknown. Smaller children don't really know what's going on, and so that's the basis, the nexus of their anxiety and their fear. Teens are looking at the known, and they understand, okay, our house was destroyed. Well, where are we going to live, and what do we do for money, and what do we do for stuff? And they can draw those lines and see how everything is interconnected. And so what we see in their reactions are withdrawal from family and friends, resisting authority, feeling like, well, there's a lot going on. I need to process my own feelings. I don't want to follow the rules. I don't want to be responsible and take care of everybody around me. Engaging in high-risk behaviors, very common. And, of course, being disruptive, whether that's at home or at school. Grades are dropping, and feeling helpless and guilty regarding the event. Okay, let's move on to helping children cope. The first thing that we always want to think about is creating a safe environment for the child so that we can encourage them to express their emotions, whether those are emotions that we as parents or caregivers want to hear or not. They're going to be difficult emotions. There's going to be sadness and anger and guilt and frustration and anxiety and fear, and these are all emotions that we don't want our children to have to experience, but it's vital after the trauma to allow them the space, that safe space, where they can express and feel and process those emotions, where we are reassuring them. We are giving them the ability to feel like they can be out of control, they can yell, they can punch a pillow, and we're going to be there reassuring them, encouraging them the whole time. We want to respect their fears, don't just dismiss them, even if the fear seems kind of strange to us. Fear that they're going to go through another intense hurricane. Well, what are the chances of a child experiencing more than one very intense hurricane? It's a slim chance. It could happen, but we still want to respect that's a fear for the child, and we're not going to just dismiss it. We want to maintain security and a normal routine. Make sure that they're exercising, make sure that they're eating well and sleeping well. If the incident was the loss of a service member, we're going to run into situations where there's a lot of media coverage, and whether that's just seeing it on TV or reading about it in a paper, or there are actually people who are, there are journalists there who want to talk to the family about the situation, interview everybody. We want to monitor exposure to the media for younger children, and for those older children, watch the news with them. Make sure that you're there supporting them through what they're hearing and seeing about their loved one. Younger children can be given something that they can hold on to, something comforting that they can keep nearby, some symbols of comfort for them. For older children, again, remember those teens, they're going to feel a lot of responsibility and a lot of pressure on themselves. You may want to actually lower your expectations on them regarding chores in school. Give them the ability to focus on processing their feelings rather than trying to keep up additional responsibilities. If this was a situation involving a natural disaster or some type of an accident, this is a good time to establish a family emergency plan. Where do you go if there's a problem? If there's a fire, where do you run to outside? If there's an accident, who do you call and how do you get a hold of them? Help them identify positive things. There are still good things going on in their lives, and there are still some positive things we can take from traumatic experiences, and helping them identify those things can help. Another thing you can do is reach out to trusted adults in the child's life. Let them know what's going on and give them some suggestions on how they can help the child, how they can support that child. Okay. Let's talk about tips for talking to children. Communication with children is going to include acknowledging that this has been a big change. This has been an incident that requires everybody to come together and communicate openly and honestly about the incident, about their feelings about it, about their fears and their anxieties, and make sure when we're doing this, we want to be open, we want to be honest, but we don't want to dwell on intimate, potentially disturbing details. A child needs to know that their parent was killed overseas while they were on deployment, but they don't need to know the very minute details of exactly how that happened. There may be a lot of questions about that, and they can be answered in age-appropriate ways, but at the same time, we need to be aware of what children need to know and what constitutes, well, that's just too much information for a child to really process. Ask the child what they think has happened. You may find that their ideas of what happened and the reality of it are two very different things, and maybe a lot of their fears and anxieties are coming from their perception of the situation. Never be afraid to admit you don't have the answers. And just because we're adults and they look at us and they say, you're omniscient, you know everything, I'm sure you have all the answers, it's okay to say, I don't really know. Acknowledge your own reactions and your emotions. These steps are vitally important. Sometimes we, as parents or caregivers, we tend to separate ourselves off from allowing children to see our own emotions and our own reactions to a traumatic incident. And the issue with this is it prevents the child from, one, having a role model for how to properly process sad and angry and fearful, all those emotions that we don't normally process in public, but still need to be role modeled for us so we can learn that, it's okay for us to express these emotions. One, it deprives them of that role model, and two, it minimizes their own responses. Well, Dad's not reacting this way, so I don't know why I should be reacting this way, and they start questioning their own feelings. So by opening yourself up and allowing your child to see that you also have some of these concerns, it's a very comforting and connective experience. If your younger child is reluctant to talk or they have difficulty verbalizing their concerns, have them draw pictures or use puppets or dolls to express their feelings. They, as we said earlier, they have a tendency to ask the same questions over and over and over again. Just go slowly, be patient, and answer the questions in as age-appropriate a manner as possible. Children are going to need encouragement and acknowledgement as they are processing their feelings. And the process, as we saw, it includes acting out as a way to get attention. And so we need to be aware that acting out behavior can be met with an encouragement on our part to communicate. Let's talk about what's going on. I understand that you just smacked me and you're frustrated, so let's talk about what's going on and why this just happened. Here we see a list of some reactions that we want to keep a close eye on, and if they don't improve after a few weeks, then we shouldn't be afraid to go on and seek some outside help. Sleep disturbance, whether that is they're sleeping too much or they're sleeping too little or there's nightmares, any type of a change in appetite, those regressive behaviors, bedwetting, thumb sucking, anything along those lines, excessive clinginess or separation anxiety. You just cannot get the child to go to school or go to an after-school event or be away from you without extreme anxiety. Withdrawing from family and friends, or unusual agitation or aggression. All of these things, if they continue after a few weeks or they're getting worse, then please reach out to whatever outside resource that you feel most comfortable with, whether that's the child's doctor or TRICARE for some behavioral health assistance, or Military OneSource, your chaplain or your pastor, or even a trusted family friend, just somebody else who can talk to that child and be a part of that child's life to help them. Dan, do we have any questions from our audience today?
We do have a couple of questions. The first question reads, my father-in-law passed away 3 months ago. My 7-year-old son was very close to him, and since the funeral, he has wanted to spend a lot of time at the cemetery. We limit taking him to once a week, but he asks to go every day. If we let him, he would spend hours there talking to Papa. Sometimes he has a tantrum if we say no to going during the week, or if we try to get him to leave before he's ready. Should we talk to his doctor about this behavior?
First of all, I'm very sorry for your family's loss. Clearly, your father-in-law was a very integral part of your family, and your son in particular loved him very much. That connection is very apparent in your son's behavior. It's a normal association for a child of that age to think, that's where Papa is now, and when I want to talk to him, that's where I need to go. And so he's trying to maintain that connection. This is very age appropriate. Again, we're looking at that almost magical thinking of, that's where I go. Just like I would go over to Papa's house and talk to him, now I go to where Papa is now and I talk to him. And the continued connection and the escalation to, he'd go every day if we let him, or he's having tantrums if we try to take him away. After this period of time, I would suggest reaching out and seeing if his doctor or another provider, whether that's a behavioral provider or a family counselor, can help you. And they may suggest things like a slow dissociation of that connection, while encouraging your son to see that Papa is with him all the time. He doesn't need to go to this physical place where he thinks that Papa is. He can talk to Papa wherever he is, or maybe setting up a little memorial in the backyard that he can plant a tree, and that'll be Papa's tree, and whenever he wants to talk to Papa, he can go out there. These are some of the suggestions that a provider may give. I certainly encourage you to reach out and find somebody that you're comfortable with and talk to them and have them talk to your son, because if it's concerning you, if it's really impacting the family's ability to move on and process the grief, then it's certainly something that does need to be addressed.
Okay, thank you. The next question reads, my daughter and I were in a car accident 6 months ago. We are okay, but the car was totaled, and they had to use the jaws of life to get us out. My daughter, who is 3, still has nightmares about the accident and cries every time we go anywhere in the car. I'm not sure what to do to help her.
Okay. That certainly is a very traumatic event. It's great that you're both okay, that you're all right. That's the first and most important thing. Obviously, having been in a car accident, you know all the sounds and the sensations, and certainly when they're cutting into the car to get you out, these are very overwhelming for us as adults, and it's just orders of magnitude more overwhelming for such a small child. And at 6 months out, and the level of anxiety that you're describing, this is certainly a time when we would want to bring somebody in to talk to your doctor. The nightmare, or talk to your daughter. The nightmares, the extreme anxiety about getting in the car, crying about getting in the car, are all things that they'll be able to work with you and work with her on to get her to associate the car not with all of that overwhelming trauma, but with that's just the thing that we use to get from place to place, back to kind of the baseline where she was before the accident. And it may involve things like giving her a special little talisman to carry with her when she gets into the car, having little routines as you get into the car, singing certain songs every time you're in the car to calm her down. It may involve just sitting in the car in the driveway so that she can desensitize to the experience of being in the car but not going anywhere, and then slowly building her up to taking her out in the car. And, as a very car-centric society, sometimes these things are really difficult to overcome. You've got to get in the car to get to daycare. You've got to get in the car to get to run errands. And so we struggle with taking the time to really process some of these things out. But certainly a provider would be able to assist you in coming up with techniques that would work with her to alleviate that anxiety.
Thank you. The next question reads, you might have mentioned this already during the webinar, but do you mind repeating the resources that Military OneSource offers?
Absolutely. Military OneSource provides a very wide variety, actually, of resources. And in addition to articles and webinars and podcasts and videos on our website, militaryonesource.mil, we also provide short-term solution-focused non-medical counseling, and we do provide individual, marital, and family counseling. In the cases of smaller children under the age of 13, it would be more family-directed, but children over the age of 13 are eligible for their own individual non-medical counseling. We would go through a brief screening and make sure that short-term counseling is going to be the most appropriate resource, but we would certainly then connect them with the most appropriate provider, whether that's one of our providers or whether we would work in conjunction with TRICARE or another behavioral health provider to ensure that that counseling happens. In addition, we do have for service members and spouses who are experiencing their own trauma or who would like to talk about some stress reactions, we offer one-on-one peer support with a service member or a military spouse. We have health and wellness coaching, which does stress management techniques and can certainly, in many cases, assist with stress reduction and anxiety reduction. So really, we just encourage you to call and talk to one of our consultants. Everybody who answers the phone has a minimum of a master's level in a behavioral health field, and so they'll really be able to discuss your various options and find the best connection for you.
Great. At this time, let me just double check. There are no other questions in the queue. So, Devin, I would like to thank you for sharing your invaluable expertise and experience. I would also like to thank our attendees for participating in today's webinar. And if you find yourself having questions after the webinar is over, please send us an email at MOS webinars at militaryonesource.com, and I'll get the questions over to our presenter, and we'll get an answer back to you as soon as we can. Thank you all for attending. This concludes today's webinar on Trauma and Children, a guide for helping children manage traumatic events. Thank you all for attending, and have a great day.